Many countries world over have faced multiple waves of the COVID-19 virus in the past. Some of them were brought on by the emergence of new variants of the virus. So far, the World Health Organization has listed 4 variants of concern, namely Alpha, Beta, Gamma and Delta. The worst among them is the highly transmissible and deadly Delta variant. But now, there is another threat that might make the world's virus-related problems even bigger. It comes in the form of a new variant called B.1.1529 and has been discovered from South Africa. Director of the Center for Epidemic Response and Innovation in South Africa, Professor Tulio de Oliveira says that there has been an unusual constellation of mutations and that it had evolved faster than any other variant. From about 50 mutations that had been observed from the new variant, more than 60 had been observed on the spike protein. The spike protein is the target of most vaccines and the key the virus uses to unlock the doorway into our body cells. Director of the Genetics Institute at the University College London, Francois Below, meanwhile suspects that the new variant would have likely evolved during a chronic infection of an immunocompromised person, possibly in an untreated HIV or AIDS patient. So far, 22 cases of the new variant has been detected in South Africa, 4 in Botswana and 2 in Hong Kong. The World Health Organization is currently monitoring the situation.
There are fewer than 100 full genome sequences that are available. We don't know very much about this yet. What we do know is that this variant has a large number of mutations. And the concern is that when you have so many mutations, it can have an impact on how the virus behaves. So right now, researchers are getting together to understand where these mutations are in the spike protein and the furin cleavage site and what that potentially may mean for our diagnostics, our therapeutics, and our vaccines. These types of variants and being detected, it's good that they are being detected. It means that we have a system in place. It will take a few weeks for us to understand what impact this variant has on any potential vaccines, for example. Our technical advisory group on virus evolution is discussing this with our colleagues in South Africa. So right now, it's a variant that it's under monitoring. The virus evolution working group, or the TAG VE, will discuss if it will become a variant of interest or a variant of concern, and if that's the case, we will assign it a Greek name. But it is something to watch. And I think, besides this B.1.1529,
even at the dawn of a new COVID variant, the World Health Organization is urging countries not to forget the age-old foe, the Delta variant.
But don't forget, we still have the Delta variant, which is also evolving. And there are at least 30 sublineages of Delta that we are tracking. We've reported on the Delta sublineage AY4.2, which has been reported from the UK. And in this sublineage, there's a suggestion that this variant has increased transmissibility slightly over the Delta variant. So the virus has a lot of room to change.
These revelations and cautions come at a time when new cases in some parts of the world, especially in Europe, as well as in Sri Lanka, are on the rise. To add to that, a global festive season is almost upon us, Christmas. Just as it does with the Sinhala and Tamil New Year season, the Christmas season too compels people to go shopping.
ප්‍රචාරණය වෙලා තියෙනවා සාප්පු සවාරිය ආරම්භ කිරීමට නියමිත දවසක් හැටියට අලුත් ප්‍රවණතාවයක් හැටියට ආද සිකුරාදා දිනය මේ තත්වය නිසි පරිදි කළමනාකරණය කර ගැනීමයි වැදගත් වන්නේ සාප්පු යෑම අද ඉඳලා පටන් ගන්න එක මගේ හිතේ ප්‍රමාද කරනවාට වඩා හොඳයි නමුත් සෞඛ්‍ය පුරුදු වලට අනුව ඒ කර්තව්‍ය කළමනා කර ගැනීමේ වැදගත්කම
Sri Lanka's bitter memories of the post-Sinhala and Tamil New Year as carefree social mixing during April brought about thousands of deaths and infections. But the message today, as it did then, is not to abuse the freedom accorded.
ඒ ලිහිල් කරලා අපි ඒක පවත්වාගෙන යන්නේ මේ උත්සව සමයේ සාමාන්‍ය පොදුවේ සමාජික වශයෙන් ආධ්‍යාත්මික වශයෙන් මේ උත්සව සමයත් එක්ක බැඳුණු අවශ්‍යතාවන් ඉෂ්ට කර ගැනීමට තමයි අපි ඒ අවස්ථාව ලබා දෙන්නේ. නමුත් ඒ අවස්ථාව රෝගයේ පැතිරීමට තුඩු දෙන ලෙසින් යම්කිසි ඉඩකඩක් පැහැදිලිවම පේනවා නම් අපිට කරන්න පුළුවන් දේ තමයි සමහර විට මේ මාර්ගෝපදේශ දැඩි කිරීම.
We've never meant lockdown when we say public health and social measures. It's a combination of interventions with physical distancing, some movement restriction in some situations, making sure that we have disinfection, we have good ventilation, we wear masks, we avoid crowded spaces. All of those interventions provide an opportunity for a layered approach. But when you add those layers on, when you start to lift them and you take those layers off, they need to be done carefully. If you take all of those layers off at once, the virus will resurge. And that's what we are continuing to see. And in the context of the Delta variant, which is much more transmissible than the original strain, the ancestral strain, if you have that in the context of increasing of people mixing, the virus will thrive.
කට උත්තර නැති වෙන්න කලින් සිග්නල් ඩීප් ක්ලීන් එකකට මාරු වෙන්න.